Welcome back guys. Now let's discuss about the respiratory zone. Okay, now respiratory zone is lined by which epithelium? Conducting zone is lined by pseudostratified ciliated columnar epithelium. But respiratory zone, we all know respiratory zone, there is exchange of gases. If you expect there is exchange of gases, if you want exchange of gases to happen, then the lining epithelium should be very simple and thin. So the lining epithelium in the respiratory zone is simple squamous epithelium, single lining, okay, simple lining is there. So that is simple squamous epithelium. Now, we all know that in the respiratory zone, there is exchange of gases taking place. Now, could you able to recollect? So, what are the zones which are coming under respiratory zone? What are the generations which are coming under respiratory zone from generation 17 to generation 23? Which includes respiratory bronchioles, alveolar ducts and alveolar sacs. All of them together called as acinus. Okay. Now, the lining cells, okay, are called as the pneumocytes. Okay, the lining cells of the alveolus or the lining cells of the respiratory zone are called as the pneumocytes. The pneumocytes are mainly divided into two types, which are type 1 pneumocytes and type 2 pneumocytes. Type 1 and type 2 pneumocytes are present. Now, important points about the type 2 pneumocytes are, so these type 2 pneumocytes are the stem cells. They are the stem cells. Just try to recollect that in conducting zone, there are stem cells present. There are two important stem cells present, which are basal cell and Clara cell. Basal cell and Clara cell are the stem cells which are present in the conducting zone. Now, in the respiratory zone, the type 2 pneumocytes are considered as stem cells. Very, very important. Now, this type 2 pneumocytes, okay, they are stem cells. Whenever there is damage to type 1 pneumocytes, the type 2 pneumocytes, they will divide and they will replace the damaged type 1 pneumocytes. Okay. Apart from that, the type 2 pneumocytes will also produce something called as surfactant. Okay. Now, what is the function of the surfactant? First of all, what exactly is the surfactant? We will discuss now. Okay. Now, surfactant, see, it is produced by which cells? Type 2 pneumocytes. Now, the surfactant production in the lungs starts by 28 to 32 weeks of period of gestation. When the baby is having 28 weeks of gestation, now surfactant is now getting started to produce in the lungs. Now, we all know during intrauterine life, lungs are immature. Lungs are totally in a collapsed state. Okay, lungs are not functioning, lungs are not matured. If you expect or if you want maturation of lungs, then surfactant need to be produced. Okay, then surfactant needs to be produced. And surfactant, from when onward the surfactant is going to be produced? Surfactant starts to produce by 28 weeks of period of gestation. Okay, now the surfactant is stored in lamellar bodies. Okay, let me show you. This is the type 2 pneumocyte. Okay, take that. This is the type 2 pneumocyte which is lining the respiratory zone or which is lining the alveolus. Now, inside this type 2 pneumocyte, there are these lamellar bodies present or there are these vesicles present. Now, inside these vesicles, who is sitting? Inside these vesicles, surfactant molecules are there. Okay, so surfactant molecules are present in these vesicles which are called as lamellar bodies. Okay, now, what is the composition of surfactant? Surfactant is made up of, surfactant is both a lipid as well as protein. So, it is a lipoprotein. Surfactant is a lipoprotein. It is a lipoprotein. Now, mostly the majority of surfactant is made out of lipids. Okay, it's majority. Okay, account for approximately 90% of the surfactant. Surfactant lipids account for 90% in the composition. So, majorly it's a lipid. Surfactant is majorly a lipid. Now, what are the lipids which are present in the surfactant? The lipids are mainly divided into two types, the major lipid as well as the minor lipid. The major lipid, the major surfactant lipid is dipalmityl phosphatidylcholine. Please look at here guys, dipalmityl phosphatidylcholine, okay, is the major lipid in the surfactant, which is also called as lecithin. Dipalmityl phosphatidylcholine, DPPC, dipalmityl phosphatidylcholine is also called as lecithin, which is the most abundant component of the surfactant, the major lipid in the surfactant. The minor lipid is also called as sphingomyelin. Okay, I should write here. There is one more minor lipid which is called as sphingomyelin. Okay, so lecithin is a major lipid and sphingomyelin and phosphatidylglycerol, these are minor lipids. Okay, now what are the two important lipids which are present in the surfactant? Yes, we know lipids are accounting for 90%. Even these lipids, there are major lipids as well as minor lipids. The major lipid is TPPC or lecithin, and the minor lipid which I want you to know is sphingomyelin. Okay, now the surfactant is also made up of proteins which are called as surfactant proteins. They account only for 10% of surfactant. The major surfactant proteins are surfactant protein A, surfactant protein B, surfactant protein C and surfactant protein D. Now we will get it out. Sir, why the hell do we need this surfactant? What is the function of the surfactant? Surfactant, see here, it decreases surface tension. Now let me show you here. Here I am showing you the alveolus. Okay, here there is alveolus. Now alveolus is lined by water or not? Yes, alveolus is having thin film of water. There is thin film of water. Okay, here there is water. Okay, thin film of water which is aiding, which is helping in the gases exchange. Okay, thin film of water is present over the pneumocytes. Okay, now air is coming into the alveolus like this. Air is coming. Here is the air. Okay, air with oxygen, carbon dioxide, air is there. Now remember, for your entire life, wherever air and water meets, okay, wherever there is air-water interference, at the junction where air is meeting with the water, there develops a destructive force, there develops a collapsive force which is called as surface tension. Imagine, just take a glass, put some water into it, and the place where, the junction where air is meeting with the water, there develops a destructive force or collapsing force which is called as surface tension. Even in the glass, that surface tension is developed. But if you ask me, sir, then why the glass is not getting collapsed? Why? Because the surface tension force, whatever is getting generated in that particular area, is not enough to collapse the glass, is not powerful enough to collapse the glass. But we are having millions and millions of alveoli are present. Now these alveolus are having a water lining. The water lining is now meeting with the air. So there is air-water interference inside your lungs. There develops a destructive force which is called as surface tension. So in your lungs and in my lungs, there is surface tension present. And that surface tension is a collapsing force. The surface tension can actually collapse our lungs. But right now, our lungs are getting collapsed? No, our lungs are not getting collapsed. Why? Thank God. There is surfactant present in our lungs. Okay, now surfactant will behave something like this. See, now the surfactant molecule are getting produced from the type 2 pneumocytes. We have just discussed surfactant molecules are produced from the type 2 pneumocytes. Now see, surfactant molecules, now they will come and sit like this. Surfactant molecules, being they are the lipids, right? They are the lipids, right? Now they are coming and forming a layer like this, a lipid layer. Now tell me, air is now meeting with the water molecules. Now air-water interference is there? No, there is no such thing as air-water interference now, because surfactant molecules, now they came and now they are dividing the air and water away. So now they are sitting in the air-water interference. So there is no air-water interference, so surface tension is not going to be there, or I should say surface tension is decreased, so the lungs are not getting collapsed. Okay, so what is the major function? The most important function of the surfactant is it decreases the surface tension, okay, or I should say decreases the collapsing force inside the lungs. Surface tension is a collapsing force, destructive force. Now other functions of the surfactant are the same. We have now seen surfactant molecules, okay, are also made out of surfactant proteins, especially surfactant protein A and surfactant protein D. They are involved in lung immunity. Surfactant protein A and D are involved in lung immunity, and surfactant molecules are also preventing the pulmonary edema from happening. Surfactant prevents pulmonary edema. So the three important functions of the surfactant are: one is surfactant prevents the pulmonary edema, surfactant proteins A and D, they have a main role in the lung immunity, and surfactant decreases the surface tension. Okay sir, well and good. Now how to assess the fetal lung maturity? See, whenever there is surfactant in the lungs, then we can say the lungs are matured. Whenever surfactant is produced inside the lungs, now we can say, okay, lungs are matured. Now, how to know whether the fetal lungs are matured or not? Okay, now there are certain tests with which you can know whether the fetal lungs are matured or not. Now, look at the levels of lecithin to sphingomyelin. Now, you will have it out. Sir, what exactly is this lecithin and sphingomyelin? Just recollect. Sir, lecithin is the major lipid and sphingomyelin is the minor lipid. So, now you are taking the amniotic fluid and now you are checking the levels of lecithin and sphingomyelin in the amniotic fluid. Actually, amniotic fluid will go into the fetal lungs, it will come out of the fetal lungs. Okay, so whatever is getting produced inside the fetal lungs, that can be reflected in the amniotic fluid. So, now take the sample of amniotic fluid via amniocentesis and now look for lecithin and sphingomyelin. Now, if the ratio of lecithin to sphingomyelin, if it is greater than 2, lecithin sphingomyelin ratio greater than 2, it indicates fetal lung maturity. Fetal lungs are matured. Okay, and shake test or bubble test. Now, take the amniotic fluid, okay, shake test, which is also called as a bedside test, Clement test, bubble test, they are all one and the same. Now, take the amniotic fluid, just shake it. Now, I have already explained to you, surfactant, what exactly is it? Surfactant is like a lipid, nothing but a lipid. Now, if the lipid is present in the amniotic fluid, just imagine, take a small beaker or take a small bottle with water, add some oil into it and now shake it. Now, what will happen if there is oil? You will have now bubbles, you will have bubble formation. In the same way, take the amniotic fluid and just shake it. When you shake it, if you are getting bubbles, it means there is surfactant which is present in the amniotic fluid, the surfactant which is getting produced inside the lungs. Now, that surfactant is now coming into the amniotic fluid. Now, okay, now surfactant production has happened in the baby. So, it acts as an assessment test for the fetal lung maturity. Okay, so shake test or bubble test or Clement test, what we are doing, taking the amniotic fluid, we are just shaking it. If bubbles are formed, now bubble test is positive, which means fetal lungs are matured. Now, lamellar body count, we have discussed in type 2 pneumocytes, okay, in type 2 pneumocyte, there are these lamellar bodies present. Again, take the amniotic fluid. Now, I have already explained to you, amniotic fluid goes into the lungs, it will come out of the lungs. Now, usually fetal cells are shedding, right? Even from the lungs, some cells are going to be like shedding. Now, you will take the type 2 pneumocyte and inside the type 2 pneumocyte, if you can find good amount of lamellar bodies. Now, if you are counting the number of lamellar bodies, if you have good count of lamellar bodies, it indicates, okay, surfactant is produced. Surfactant molecules are already there inside the lungs. So, lamellar body count is used as an assessment test for fetal lung maturity. But what is the best test for fetal lung maturity? The best test for fetal lung maturity is looking phosphatidylglycerol levels in the amniotic fluid. Okay, if phosphatidylglycerol, if this molecule is present in the amniotic fluid, means 100% that fetal lungs are mature. Okay, there are different tests like lecithin sphingomyelin ratio, bubble test, Clement test, or lamellar body count. Even there are many other tests which are there. But the best test for fetal lung maturity is phosphatidylglycerol levels, checking the levels of phosphatidylglycerol in the amniotic fluid. Okay, now next let's discuss what are the factors which will stimulate the surfactant production. Okay, surfactant production is stimulated by and surfactant production is inhibited by. Now, surfactant molecule production is stimulated with the help of certain hormones like steroids, especially the glucocorticoid. So, glucocorticoids which are produced in the baby, now these glucocorticoids, they will stimulate the type 2 pneumocytes to produce the surfactant. And thyroid hormones, prolactin, epidermal growth factor and CAMP, all of this will stimulate the production of surfactant. In exam they can ask you, all of the following will stimulate the release of surfactant except. So, important point which I want you to know is the glucocorticoids. Okay, glucocorticoids will stimulate the surfactant, or the steroids will stimulate the surfactant production in the baby. And the thyroid hormones T3, T4, prolactin, all these will stimulate the surfactant production. And the surfactant production is inhibited by insulin. Okay, surfactant production is inhibited by insulin. Now, let's discuss a few clinical scenarios. Okay, for example, there is this one mother who is going into preterm labor. Okay, now there is this one mother who is having 31 weeks of period of gestation. Okay, 31 weeks of period of gestation or 30 weeks of period of gestation. Now she is going into the labor. Now, normally labor should have to happen somewhere around 37 weeks, 38 weeks. That's okay. But now if she is going through the labor, okay, now if she is having the premature, now if she is having contractions, which means that she is going into labor. This is pre-term labor. Even without term, she is having the labor. Now, notice one point. If there is preterm labor, you cannot stop it. You cannot stop it. You can only stop it for the maximum of 1-2 days. Okay, you can only stop it for the maximum of 1-2 days. Now, you are having one problem. You are worried about whether the fetal lungs are matured or not. Okay, now in this 1-2 days, what you can do is, you can produce surfactant production inside the body of the baby. So what you are going to do? Now, you are going to give injections of steroid to the mother. You are giving steroid injections into the mother. Now these steroid injections from the mother is going to enter into the baby. Now steroids we have discussed, especially the glucocorticoid. Okay, now the steroids will stimulate the production of surfactant. 1-2 days are enough. Now if you give the steroids to the mother, now the steroids will cross the placenta, enters into the baby. Now in the baby, the steroids will stimulate the production of surfactant. Okay, so that's why in preterm labor, what we will give? We will give steroids or glucocorticoids to the mother. They will increase surfactant production. Now, everywhere in the world, okay, now beta-methasone is used. Okay, everywhere in the world, beta-methasone injection. Beta-methasone is a steroid. It's a glucocorticoid, right? So, beta-methasone injections, 12 milligrams will be given in 2 doses. Okay, 12 milligram. Now, right now, after 24 hours, one more 12 milligram injection of beta-methasone is given to the mother everywhere. So this everywhere in the world this is used, but in India dexamethasone injections are used. In India, dexamethasone injections will be given in 4 doses. Okay, will be given in 4 doses, 6 grams. Okay, now not 6 gram, it's 6 milligrams. Okay, 6 milligrams of dexamethasone given in 4 doses, 12 hours apart. So this is what I want you to know in preterm labor. In preterm labor, what's the main problem? In preterm labor, you are worried that whether the baby is having proper amount of surfactant or not. So in order to increase the surfactant production, what we are giving? Steroids. Why we are giving steroids? Why? Because steroids will stimulate the surfactant production. Okay. So preterm labor is completed. Now let's discuss about a disease called as a hyaline membrane disease or respiratory distress syndrome. Now a baby was born. Okay, now a baby was born. Now this baby is having a disease called as hyaline membrane disease. Why the baby is having hyaline membrane disease or respiratory distress syndrome? It's simply because there is no surfactant in the baby's lungs. Okay, baby is born, but there is no surfactant. If there is no surfactant, what happened to the surface tension? Surface tension in the baby's lung is more. Okay, surface tension inside the baby's lung is more. Now this surface tension, what it is doing, it is collapsing the fetal alveolus. It's collapsing the fetal lungs, causing respiratory distress in the baby. So that is respiratory distress syndrome. The respiratory distress syndrome, what is the major cause? The major cause is deficiency of surfactant. Now you can ask me, sir, why the surfactant is not there? Why? Because one reason might be, okay, premature infants or the mother is having gestational diabetes mellitus. Okay, premature infants you can understand. Okay, delivery happened by 31 weeks. If delivery happens by 31 weeks, now to such a female, dexamethasone injections are not given. Now 31 weeks, labor have started, now she have delivered the baby. Now we all know there is no proper amount of surfactant which is produced. If there is no surfactant, respiratory distress will happen. Okay, in preterm infants there will be respiratory distress syndrome. True statement. Now if the mother is suffering with diabetes gestational mellitus, okay, if the mother is suffering with gestational diabetes mellitus, now every time what she is taking? She is taking the insulin injections. Okay, if you are suffering with diabetes mellitus, insulin injections are given. Now if she is taking excessive amount of insulin, what insulin will do? Now this insulin will inhibit the surfactant production. So in the baby's lungs, surfactant is not produced. Surfactant levels are very, very less. Again, respiratory distress syndrome is seen. Okay. Now, delivery by C-section. If you do delivery by C-section, that also can cause respiratory distress syndrome. The concept here is, usually in a normal vaginal delivery, NVD, there is a lot of stress. The baby have to pass through the narrow genital tract. So the baby is under a lot of stress. Now, whenever there is a stress inside the baby's body, which hormones are going to be produced? The stress hormones, sir. Cortisol is going to be produced. Okay, cortisol is going to be produced. Now, cortisol, what exactly is it? Cortisol is a glucocorticoid. So, when the baby is passing through the genital tract in a normal delivery, cortisol levels will be elevated in the baby. Now, the cortisol levels will stimulate. Okay, cortisol levels will stimulate more production of surfactant. So, surfactant is going to be produced more in concentration. The surfactant is going to decrease the surface tension. But if a baby is delivered via C-section, just via C-section, now baby is not under any stress. There is no stress hormone. If there is no stress hormone or no glucocorticoids, the amount of surfactant concentration, of course there is surfactant, but the amount of surfactant concentration can go sometimes too low or too less. So, that can cause respiratory distress syndrome or hyaline membrane disease. Okay, so these are the important points which I want you to know. Okay, two clinical integrations, that is one is hyaline membrane disease due to and seen in. And why in preterm labor? Why in preterm labor we choose to give steroids? To produce surfactant. Okay, so everywhere in the world dexamethasone is used, but everywhere in the world betamethasone is used, but in India we use dexamethasone injections. Okay, hope the video is helpful. In the next video, we'll start with the mechanics of breathing. Thank you.